At just 30 years old, Alex Hernandez has already faced a lifetime of health issues, fighting kidney problems since he was a baby. His childhood riddled with trips to the hospital.
Yeah, looking back at it was tough. Like, you know, I would sometimes cry because, like, I'm like, why do I got to deal with all this that's going on with my health? You know, all these other people are fine.
In college, things took a turn for the worse. His kidneys failing, forcing him to go on dialysis.
Did you think I may never get off of this?
At one time I did.
His only hope was a kidney transplant, but that meant he'd have to spend the rest of his life taking immunosuppressants every day to stop his body from rejecting the organ. These drugs, which can be up to 30 pills a day, can have nasty side effects, including stomach problems, increased risk of infection and cancer, and can even damage the new organ itself.
So one of the major drugs that's purpose is to prevent the body from rejecting a kidney can actually harm the kidney itself.
Exactly.
Dr. Sanjeev Akina, medical director of the kidney transplant program at Loyola Medicine in suburban Chicago, is one of a handful of doctors around the world trying to solve that problem by developing therapies to help with organ tolerance.
So I think when we say tolerance, we're basically saying is, can the body accept someone else's kidney without rejecting the kidney? I think the idea that you can actually be off of anti-rejection drugs for the rest of that life, I think there's a lot of benefit for that.
Now, they may have found a way, using stem cells taken from the donor.
So the stem cells, what they do is they basically reprogram your immune system. They basically tell your immune system to recognize that this donor kidney coming in is actually going to be part of your own.
The cells get implanted 11 days after the new kidney, helping the patient's immune system become a hybrid of both the donor and the recipient, preventing it from attacking the new kidney and allowing the patient to stop taking all of those immunosuppressive drugs. A new phase 3 trial presented today at the American Transplant Congress found that after 2 years, almost 85% of patients were off all the anti-rejection meds. Doctors are hopeful this could one day apply to other types of transplants.
How do you feel?
Feel good.
Alex underwent his transplant 3 years ago. He's no longer on any immunosuppressive drugs. Now a dental student, Alex says he has a second chance to live a full life.
I'm able to work out. I'm able to, you know, play sports. I'm just grateful that I can do all those things now.
Wow. And Dr. Syal joins us now. Dr. Syal, it seems like stem cells to the rescue again, potentially. How big of a deal is this?
Hey, guys, these are really encouraging, really exciting results. As you mentioned in the intro there, you know, the word tolerance, allowing the body to accept the new organ is really what scientists have been after for decades, really called the holy grail of organ transplantation. Now, I should add, you know, in this case, Alex did get an organ from his sister, so these are very closely genetically related people. And really the next step here, Gotti, is can we expand this to the millions of people out there who may have, you know, gotten an organ from somebody they're not related to? Because, you know, as you heard in the piece, these drugs can be really, really nasty. They can have stomach problems, you know, if you were to get COVID or the flu, you would get way sicker than, you know, you and I would. So really a lot of people are trying to get off of these drugs. A lot of people looking forward to a day where they may not have to take these drugs, and a little bit of hope even in this small trial here today, Gotti.
Yeah, seems like a lot of hope there. We need our immune systems, and yet people need these new organs. So where do you see this going from here?
Yeah, a couple things need to happen. You know, this was a trial of about 19 patients, so we need to see this replicated in a larger study. I mean, Gotti, really the next step is can we expand this to people who aren't so genetically similar, right? So, for example, if you were to give me a kidney, could I eventually be off those immunosuppressants? That's really the ultimate goal here. And also, can we expand this to other organs, right? So kidneys are the most transplanted organ here in the United States, but there are other organs that would, you know, heart, for example, or liver that we're hoping to expand this to. So really a lot to look forward to, and just a little bit of hope here today could, you know, for millions of people out there who are taking up to 30 pills a day of those drugs that weaken their immune system.
Absolutely. And doctor, if you ever need a kidney, I got you, brother. Thank you so much for joining us
Appreciate
tonight.
it.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.